A warm welcome to everybody. I am Dr. P. Vinod Kumar, Associate Professor from the Department of Forensic Medicine at Sree Balaji Medical College, Krompet, Chennai. So today I'll be talking about medical ethics and its principles. So what are the specific learning objectives of this session? First, to define what is medical ethics, to know about the principles of medical ethics, and what are the duties of a doctor or a physician. Ethics is concerned with moral principles, values, and standards of conduct, according to the WHO. Ethics is the study of morality, careful and systematic reflection on and analysis of moral decisions and behavior. So, morality is the value dimension of human decision making and behavior. Courtesy, World Medical Association, Manual of Medical Ethics. So, ethics comes from the Greek word ethike. It means habit, action, and character. The Latin word mos, morals, means habit or custom. In simple words, ethics is a set of philosophical beliefs and practices concerned with the distinction between right and wrong. Ethics is a very large and complex field of study with many branches or subdivisions. Medical ethics is a branch of ethics that deals with moral issues in medical practice. Medical ethics is closely related but not identical to bioethics or biomedical ethics. So, what is medical etiquette? The conventional laws, customs of courtesy, and the code of conduct governing the relationship of the physician with his professional colleagues. So, doctors not expected to charge for giving medical advice and or medicines to another doctor. Professional etiquette means the rules and conventions governing correct or polite behavior in a specific professional group or situation. Professional etiquette is applicable in any professional setting. It includes how you greet people, how you show respect to seasoned professionals, how you introduce yourself, how you network yourself, what you wear, how you eat and drink with other professionals. In recent times, medical ethics has been greatly influenced by developments in human rights. Physicians frequently have to deal with medical problems resulting from violations of human rights, such as forced migration and torture. Medical ethics is also closely related to law. Quite often, ethics prescribes higher standards of behavior than does the law, and occasionally ethics requires that physicians disobey laws that demand unethical behavior. So, what is the importance of medical ethics? Ethical principles such as respect for persons, informed consent, and confidentiality are basic to the physician-patient relationship. Application of these principles in specific situations is often problematic, since physicians, patients, their family members, and other healthcare personnel may disagree about what is the right way to act in a situation. The study of ethics prepares medical professionals to recognize difficult situations and to deal with them in a rational and principled manner. Ethics is also important in physicians' interactions with the society and their colleagues and for the conduct of medical research. So, what are the principles of medical ethics? So, to remember the principles of medical ethics, I have given a mnemonic, capital A, B, C, D, E. So, A stands for autonomy, B for beneficence, C for confidentiality, D, do no harm, or non-maleficence, E. Equity or justice. So what is autonomy? Patient has freedom of thought, intention and action when making decisions regarding healthcare procedures. So for a patient to make a fully informed decision, she or he must understand all risks and benefits of the procedure and the likelihood of success. This includes the need to tell the truth, veracity, and to be faithful to one's commitments, fidelity. What is beneficence? The practitioner should act in the best interest of the patient. The procedure to be provided with the intent of doing good to the patient. So patient's welfare is the foremost consideration. Confidentiality. It is based on loyalty and trust. A doctor should maintain the confidentiality of all personal, medical and treatment information of the patients, information to be revealed for the benefit of the patient and when ethically and legally required. Do no harm or non-maleficence. Above all, do no harm to the patient. Make sure that the procedure does not harm the patient or others in the society. Whenever a doctor cannot do good, he must be kept from doing harm. Equity or justice. Fair and equal distribution of scarce health resources and the decision of who gets what treatment should be done. The burdens and benefits of new or experimental treatments must be distributed equally among all groups in the society. So what are the duties and responsibilities of physician in general? So what should be the character of a physician? He should uphold dignity and honor of his profession. Render service to humanity. He should be a person with recognized qualification, and a person with this qualification can only practice modern system of medicine. Maintaining good medical practice. Render service to humanity with full respect for the dignity of profession and man. Maintenance of medical records. Maintain the medical records pertaining to his or her indoor patients for a period of not less than 3 years. Records to be given within 72 hours if requested by the patients or legal authorities. Always maintain a register of medical certificates giving full details of certificates issued. Display your registration numbers. And as far as possible, use generic names of drugs. The highest quality of assurance should be given in patient care, and a doctor should expose unethical conduct even among his own colleagues. Payment of professional services. Personal financial interests of a physician should not conflict with the medical interests of the patients. Evasion of legal restrictions. The physician shall observe the laws of the country in regulating the practice of medicine. Duties and responsibilities of physician. Obligations to the sick. Always respond to the calls of the sick or patients. If the ailment is not within the range of experience, he can always refuse treatment and refer to a senior doctor or different specialty. Patience, delicacy and secrecy. Patience and delicacy should characterize the physician. Secrecy of patients should be maintained except when required by laws of the land and to protect healthy individuals. Duties of physician to their patients. Prognosis. Neither exaggerate or minimize the gravity of patient's condition, and do not neglect the patient. A physician is free to choose his or her own patient, but once undertaken, he should not neglect the case. Always respond to requests in emergency. Duties of physician during consultation. Avoid unnecessary consultation. For example, consulting radiologist or asking some lab investigation, it should be done judiciously. Unwarranted investigation should be avoided. Consultation for patient benefit. Always think of the patient, whether this consultation or investigation is going to benefit the patient. Punctuality in consultation. Always come in time or inform the patients if you are coming late. Statement to patient after consultation. That is, tell the patient in the local language the patient can understand what is his problem, what is he suffering from, what are the treatment options, what investigation should be done, should he get admitted or not, and what is the prognosis. And then the patient can be referred to a specialist if required. Fees and other charges should also be specified by the doctor initially itself so that there is no differences. Responsibilities towards each others. Dependence of physicians on each other. A doctor should consider it as a pleasure and privilege to render gratuitous service to all physicians and their immediate family dependents. Conduct and consultation. Respect should be observed towards the physician in charge of the case, and no statement or disparaging remark should be made against the physician. Treat your colleagues with respect. Appointment of the substitute. A doctor can appoint a substitute only when he has the capacity to discharge the additional responsibility along with his or her other duties. Visiting another physician's case. Avoid remarks upon the diagnosis or the treatment that has been adopted by the physician. Duties of physician to public and paramedical staff. Physicians as citizens should particularly cooperate with the authorities in the administration of sanitary and public health laws and regulations. Public and community health. A doctor should enlighten the public concerning quarantine regulations and measures for the prevention of epidemic and communicable diseases. Pharmacists and nurses. A doctor should promote and recognize the services of pharmacists and nurses and always seek their cooperation. So to conclude what you discussed till now, that is regarding medical ethics. What is medical ethics? It is the moral principles, values and standards of conduct observed by the physician towards his patients. And we have seen about medical etiquette. So medical etiquette is basically the laws of courtesy observed among the medical colleagues. And we have seen the principles of medical ethics. That is how to remember it is the mnemonic A, B, C, D, E. So A stands for autonomy, B for beneficence, C for confidentiality, D for do no harm, and D for equity of justice. And we have seen the duties of a doctor with regard to his patients, how to treat his patients, and with regard to consultation, how much fees he should charge, and how transparent he should be with the patient. And before doing any procedure, what is he has to take consent, and he has to inform the patient about his condition in the local language which can understand, the treatment protocol, and then only proceed. So we have seen this, and duties of a doctor among the colleagues. When treating colleagues, we should respect our colleagues. We should not make disparaging remarks against our colleagues. So this is in brief about the principles of medical ethics, medical etiquette, and the duties of a doctor. So to conclude, I would like to quote from Albert Einstein, who said, "Try not to become a man of success, but rather try to become a man of value." Thank you.